Insomnia risk factors. Diagnosis and treatment. Insomnia can affect people of any age or sex, though it most commonly develops in older adulthood just before, during, and after menopause. Risk factors associated with insomnia include high levels of stress, which might relate to life challenges, financial difficulties, or family and relationship concerns. Traveling to different time zones. A sedentary lifestyle. Varying sleep-wake times or an irregular schedule, which might happen with frequent changes in work hours or shift work. Taking naps. Drinking a lot of caffeine, alcohol and tobacco use. Difficulty winding down at bedtime. Diagnosis. When considering a diagnosis of insomnia, a healthcare professional will generally ask questions about any existing medical conditions, physical and mental health symptoms you've noticed, stressors in your personal or professional life, sleep history, including how long you've had insomnia symptoms and how they affect your daily life. Treating insomnia. Cognitive behavioral therapy, CBT, for insomnia. The American College of Physicians, ACP, recommends CBT as a first-line treatment for chronic insomnia in adults. In fact, experts have developed a specific subtype of CBT to treat insomnia, CBTI. With support from an online or in-person therapist, you can learn specific techniques to address insomnia, including stimulus control. This technique teaches you to get out of bed and find a quiet and relaxing activity until you feel sleepy, limiting the time you spend lying awake and worrying about falling asleep. Sleep restriction. This technique first restricts and then gradually increases the amount of time you spend in bed, which can help improve sleep efficiency and sleep quality. Bright light therapy. This technique involves exposure to bright light in the morning or evening, depending on whether you have more trouble falling asleep or staying asleep. Medications and supplements. Your clinician might also prescribe medication to treat insomnia, such as sopicolone, lunestazolpidem, Ambien triazolam, Halcion over-the-counter, OTC. Sleep aids and supplements like melatonin can also offer some relief from insomnia. Other approaches. Lifestyle changes and home remedies can often help manage insomnia symptoms. Ideas to try include natural sleep aids. You might try, for example, warm milk, herbal tea, and valerian before bed. Relaxing fragrances like lavender may also offer some benefits. Meditation. This technique helps promote present moment awareness and relaxation. It doesn't just help improve sleep quality and make it easier to fall asleep. It can also help relieve stress, anxiety, and pain, any of which might factor into insomnia. Many apps can help you get started with meditation. Acupuncture. Many people find this traditional Chinese medicine technique, which involves thin needles inserted at pressure points across the body, helpful for easing insomnia symptoms. Preventing insomnia. It's not always possible to prevent insomnia, but these tips may help you get the sleep you need. Try to maintain roughly the same schedule for sleeping and waking, even on weekends. Create a bedtime routine that helps you relax and get in the mood for sleep. Limit afternoon caffeine. Dim the lights and put down electronic devices an hour or so before bedtime. Get some sunlight and physical activity most days or every day, if possible. Avoid napping, especially if you know sleeping during the day keeps you awake at night. Work with a therapist to address mental health symptoms like anxiety and depression as soon as you notice them.